Good
All right, so last but certainly not least, Dr. Joseph Maroon. You guys will love this. So Dr. Maroon is the Vice Chairman of the Department of Neurological Surgery at the University of Pittsburgh Medical Center. He's the Senior Vice President of the American Academy of Anti-Aging Medicine. He's a neurosurgeon for the Pittsburgh Steelers. Go Ravens. Dr. Maroon, has completed close to tens of thousands of brain and spine operation. He is a triathlete, having competed in over 75 triathlons, and in particular, 8 Ironman distance triathlons in Hawaii, Canada, New Zealand, and Germany. I feel lazy. He is a research neuroscientist as well, and he's published over 300 peer-reviewed papers and 6 books. Please welcome Dr. Maroon to the stage.
Thank you so much, Verdin. Well, thank you very much, Dr. Cook. It's a really terrific pleasure to be here with you this afternoon. And quite frankly, listening to the prior speakers, I'm not sure what I bring to the audience, except, are there Steeler fans here? Well, what I bring is what they don't have. They may have better labs, better technicians, but they don't have a Super Bowl ring. Which we don't have this year. That's what fumbles do in playoff games. So I'm here to discuss with you how to attain peak performance at any age, with a lot of interest in athletics personally, as well as with professional athletes, college athletes over the many years. I'm going to discuss exactly that, how to attain peak performance at any age, maybe a little presumptuous, but I'm going to share with you not only successes, which Dr. Cook nicely elaborated upon, but also some failures. And I'm going to tell you how a single run around a high school track saved my life, and also discuss stress, how it affects the body and the brain. What's the best antidepressant? I'm going to give you a prescription for that. It's not a serotonin reuptake inhibitor, Prozac or Zoloft, and how to attain peak performance at any age. So this past Christmas, a friend of mine gave me this stanza from Dylan Thomas. Do not go gentle into that good night. Old age should burn and rave at close of day. Rage, rage against the dying of the light. So I want to do that, but how do you rage against the dying of the light when the foundation is cracking from degenerative arthritis, the windows are cloudy from cataracts, the water's leaking from benign prostatic hypertrophy, and the roof is threadbare from alopecia? You know, you feel like this, but you want to look like this. But that's what preventive medicine is all about, which is what my prior colleagues have spoken to you about. So the question is, how do we die young as late as possible? You know, the average age of this group is about 68 years of age. I'm right there with you. In fact, I exceed that by a bit. And we're very much aware of all of the difficulties that occur, as I just alluded to. The frame's cracking, the windows are cloudy, and the water's leaking, as well as much more. And what I'm going to do, it's said that data tells, but stories sell. So I'm going to make this a very personal talk. And I'm going to talk about the first 15 years of my life, of my professional life, which was spent learning about brain aneurysms and traumatic brain injuries, spinal cord injuries, brain tumors of various kinds, and how to take care of those and deal with them. That's the first 15 years. The second 15 years was spent putting those tools, those learning skills to work, seeing many, many, many patients over 50 years now. And I went to the University of Pittsburgh, and I was appointed the first team doctor for the Steelers, in fact, in the NFL, as a neurosurgeon, and was really doing very nice research. And we were pioneering a technique of awake brain surgery, where we were removing tumors from eloquent areas of the brain under local anesthesia with the patient awake, and feeling very, very good about things and flying high, somewhat like Icarus, if you might remember Icarus. And as Nietzsche said, all things must suffer, go dark, and perish before they live again. So as I was soaring with my successes, very, very suddenly, in the course of 1 week, my father died of a heart attack at age 60. I was 40 at the time. A family came apart because I was so successful and had a lot of titles and positions and amulets of success, but I wasn't that successful in a family at the time. And I had to quit neurosurgery, and I literally moved into this house in the middle of winter in Dallas Pike, West Virginia, and with my mother. It was the Oedipus complex. The king dies and moves in with the mother. And I worked in this truck stop that was bequeathed to my mother, very heavily mortgaged. And I ended up filling up 18-wheelers, flipping hamburgers, after the week or two before doing awake brain surgery on patients at the University of Pittsburgh. So it was a pretty big fall. And I subsequently realized that every one of you right today are writing your own life story every day. And the life of every man is a diary in which he means to write one story, but often too often writes another. His humblest hour is when he compares the volume as it is with what he vowed to make it. I did not end up, after 30 years of education, wanting to work in a truck stop. I experienced very firsthand stress, incredible stress. And how stress affects the body, I subsequently became a student of. And I became aware of the mind-body connection, how the mind can make the body very sick. Stress causes heart attacks, irritable bowel syndrome, ulcers, strokes. It's very, very deleterious. And there's a whole new discipline called psychoneuroimmunology, how the brain affects the various hypothalamic pituitary endocrine system I'll mention in just a second. But stress is not all bad. We need stress. If we don't stress our muscles, we don't get stronger. If we don't stress our brains, we don't get cognitively more aware and smarter. So we need stress, but there's eustress, EU meaning good stress, and distress. And you need to somehow be aware, like the Buddhists say, you have to be mindful and aware of your own thermostat for stress and where you are. Because what it does affect, it affects your immune system. It suppresses the immune system. You become more susceptible to cancer, heart attacks, strokes. And it also affects the endocrine system. Cortisol becomes hypersecreted. Hypersecretion of cortisol leads to osteoporosis and also degeneration, neurotoxicity of the brain, and also the symptoms of anxiety, depression, and insomnia, all of which I experienced firsthand. And having experienced all these things, and I'll tell you how I got out of it, but I subsequently wrote a book entitled Square One, A Simple Guide to a Balanced Life. And Sanjay Gupta at the very bottom said, this book has already changed my life. And right now, I'm going to give you an experiment, a study. Right now, you have pencils and papers and you have your brain. I want you to draw a square. Draw a square and write on the top, work, on the left side, family, relationships, spirituality, and on the other side, physical, okay? Now, I want you to draw a line commensurate with how much effort you spend on each one of these in a day. How long is your work line? How long is your family line and relationships, your spiritual line, and your relationship line, or physical line? It should resemble a square. Mine at one point was a flat line EKG. It was all work. No family. Spirituality was completely atrophic, and I was 20 pounds overweight. And so I was in this situation for quite a few months until the local banker who held the mortgage on the truck stop called me and said, "Joe, we need to go for a run." And I said, "Run? I can't walk up a flight of steps without being short of breath." But I found a pair of tennis shoes, a pair of scrubs. We went down to this high school track in Triadelphia, West Virginia, and I made it around 4 times, and I said, never again. I was out of breath, I hurt, I said, I'm finished with this. But that night, something very strange happened. It was the first night I slept in months. So I went back the next day, and I did 1.25 miles, and then the next 1.5 miles, 2, 3, and pretty soon, I was like Forrest Gump in Bridgeport, Ohio. They said, there he goes. And I subsequently learned to swim and also got a bike, and I competed in a small triathlon. And 0.5 mile swim, bike 15, and run 6.2. And I thought I was like Roger Bannister breaking the 4-minute mile when I did that. But something very strange was happening, and subsequently, being interested in neuroscience, I wondered what's going on in your brain when you exercise. You've all heard this from Eric and others. But what's happening is you make a molecule called BDNF, brain-derived neurotropic factor. And this compound creates new brain cells, new synaptic connections, and enhances neuroplasticity in the brain, the ability to take a huge amount of information and spew it out like I'm doing right now. It also reboots your neurotransmitters, those chemicals at the synaptic junctions that really give you your feeling, who you are, what you do, how your cognitive ability. So it became very apparent, and it is, the best antidepressant is physical aerobic activity. The hardest thing to do when you're depressed and down and feeling like crap is to go to the gym or take a walk or get on a stationary bike. But it's much better than any drug you can take. And the mind-body connection, I told you how the brain can make the body sick, but the body can heal the brain. Very, very important. The body can heal the brain. My brain was very, very sick until I took a run around that high school track and then subsequently increased the intensity. And I continued to increase the intensity in the bar, not because, when Kevin introduced me and said I did 75 triathlons and 8 Ironman distance races, yeah, that's very impressive. Not many people really do that. But it really was life-saving. I wasn't doing it to boast or prove anything to anybody. It was my way of maintaining peak performance at any age with what I did. It rebalanced my neurotransmitters. It reset my tone, my mood. And I was able eventually to compete in the Hawaiian triathlon, which is a 2.4 mile ocean swim, a 112-mile bike, and then a marathon. And this is what the swim looks like. If you don't position yourself right, you get shoved and knocked under the water. They have scuba divers underneath in case you drop out. And this is Heinz Ward. Heinz was a former Steeler player who was paid $500,000 to do the Ironman triathlon. And also, he was sponsored by chocolate milk. And I told Heinz, I said, Heinz, look, I've done this before. I know about these things. I'm happy to be a sponsor also of chocolate milk. Sure, Joe, I'll talk to the company. So the next week, I got a 6-pack of chocolate milk. He got a $20,000 bike. But this is finishing the triathlon. And there's no greater thrill, quite frankly. And the races that I've been able to, some of the races I've competed in. But the point I want to make, we're talking about peak performance at any age, and I'm kind of giving you an overview and a storyline of how it's accomplished. So performance and arousal, again, it's a curve. You have to be aware when you're overtraining or overdoing it so that you don't burn out. So in addition to exercise, these are the epigenetic factors. You heard a lot about genes and DNA. Epigenetic factors are those factors above the genes that tell your genes which proteins to make, as Dr. Roizen said. So if you eat a Big Mac infused with antibiotics and hormones in a feedlot, and order of trans fatty acids on your French fries and a bottle of phosphoric acid called Coke, it's going to tell your genome to make inflammatory agents. What's the common cause of cancer, Alzheimer's, stroke, diabetes? It's inflammation. Whatever you can do to reduce inflammation, you're going to help with your longevity and your health span. The same with exercise and being careful of the water and how you drink and organic versus non-organic. And stress is neurotoxic to the brain. In contrast to a Mediterranean-type diet, polyphenols, appropriate supplements, exercise, clean air, water, and a strong family unit is a very important thing. If you read Dan Buchner's book, Blue Zones, the common factor of all the centenarians that he studied is that these epigenetic factors are operant. Their diet is kind of a Mediterranean diet. They work hard. They have a clean air and clean environment, and they have strong family units for when the bottom drops out, and it always does at some point, and also they get enough sleep. So trying to do my exercise and do the things that I know epigenetically what I'm supposed to do. I also, about 3 or 4 years ago, met Dr. Afradi, David Globig, and Amir here at the Aviv Hyperbaric Center. And I decided to get involved and learn about hyperbaric oxygen therapy. And subsequently, how I've done a lot of work with traumatic brain injuries, particularly concussions, CTE, post-concussion syndrome, and particularly in sports, but also stroke, cognitive impairment, memory impairment, long COVID, and how to enhance performance. And I'm going to share some of the thoughts on that with you. And these are the generally accepted and paid for conditions for hyperbaric oxygen use. Wounds that won't heal, in particular, are those burns, traumatic infections, gas emboli, even acute hearing loss is something that you should keep in mind. And these are generally accepted, payable, reimbursable things. Brains of the wound, the government won't cover. Insurance companies won't cover. Wounds of the brain, the government won't cover. But they will of your diabetic ulcer ready to get an amputation. So I looked into the literature a bit. And one of the things you've heard about, and many of you know, is telomeres. And you heard about immunosenescence, senescent cells from Dr. Hadanny and others. And they've shown in very good studies how hyperbaric oxygen increases telomere length, which is, as we age, our telomeres shorten until they finally shorten to the point where the cells are no longer functional and they become senescent. And senescent cells spew out all sorts of cytokines and cytotoxins that are deleterious to the body and brain. So they've shown that telomeres actually can be increased and elongated with hyperbaric oxygen therapy. And these are my telomeres that I underwent 60 treatments of hyperbaric oxygen, and I'll show you what I did before and after, but my telomeres were elongated by 100%. Now, you have to remember my age. 100%, the delta for me is not going to be the same as somebody 22 years of age. But regardless, it clearly is a biomarker that one can look at in terms of effectiveness. For training and performance, Amir Hadanny and Dr. Afradi and others did another study. They took middle-aged athletes and they gave them hyperbaric oxygen therapy, but beforehand, they did a whole lot of biomarker studies. They did a biopsy. They put a large needle into the buttock, the gluteus maximus of these athletes, biopsied the muscle, and then looked at the muscles for mitochondria. Mitochondria are the organelles in every cell of our body that makes energy, oxygen and glucose to make ATP. And what they found was there was mitochondrial biogenesis. Mitochondria actually became more proliferative and more active, meaning more energy, more effectiveness in terms of the operations of every cell. And they also saw that not only they did evaluations looking at cognition, their energy level, and general satisfaction. And you can see the improvement before and after the use of hyperbaric oxygen in this healthy middle-aged group. And their cardiopulmonary function also significantly improved. So, is this something that elite athletes, if you get a 1 or 2% increase in your ability at a high or low level, it can be very significant. So with this kind of information, I decided to be an experiment of one. And I went to the Aviv Center for 3 months, and every day, 5 days a week, 2 hours a day, I underwent dives, as they're called, or treatments. But beforehand, I measured my brain speed, my processing power, my memory. I had brain scans, my MRI, SPECT scans that Dr. Hadanny spoke about. And I also had various blood evaluations in terms of my cardiorespiratory fitness, and also did balance and flexibility tests. So I did all this before. And then post, there was clearly an improvement in recall, improvement in my executive function, planning, organizing, mild improvement in attention, and mild improvement in processing speed. And all very nice. Clearly, it wasn't worse. But again, objectively, the scans that I had afterwards, this is an MRI showing before and after in terms of blood flow to various parts of my brain. And significantly, the blood flow to those parts of my brain correlated with those parts of brain function in terms of attention, salience, and other functions that were positive. That same thing was confirmed on SPECT scan in terms of blood flow. These are two different modalities, but measure blood flow to different parts of the brain. So the other thing that we mentioned earlier was about inflammation, the common genesis of so many of the diseases of aging. And Alzheimer's, diabetes, arthritis, all of these come from mostly, I didn't realize what Eric said, that 73% of what affects us is epigenetic or environmental, and 7%, 8% is genetic. So I measured also very specific proteins in my blood, proteomics, and at 40 dives, there was a precipitous drop in the inflammatory markers that are associated with inflammation. So again, it's not that I just feel better, but there was a major biomarker change that I couldn't control, indicating that the inflammatory process was less. And I actually published this in a peer-reviewed journal, Frontiers in Neurology, the difference between 0 and 1, and the kind of my own personal experience and the results. And the CPET is the cardiopulmonary exercise tests that were done. I got on a treadmill, breath with a mask, breathing, measuring my oxygen, anaerobic threshold and aerobic threshold, my VO2 max. And post-treatment, there was improvement in lung capacity, improvement in exercise endurance, and actually some improvement in muscle strength. And to cap it off, I actually did a triathlon before and after. And in looking at my cardiopulmonary tests, I improved by about 9% in my aerobic and anaerobic capacity. And I was able to finish the marathon or the triathlon by about 9 or 10% improvement in my time before and after. So I was very pleased with that. And I actually came in first in my age group, but I know this audience fact checks everything. I was the only one in my age group. And last year, I competed in the senior games in Fort Lauderdale and came in second. And the guy who won, I'm sure he lied about his age. And then again, talking about peak performance at any age, one of my fondest and greatest experiences was in August of 2022, I did the Chicago Triathlon with my daughter, who's 28 years old, for the first time, and she kicked my butt, but we both finished and had a great time, and it was a very family bonding experience. So I've given you a lot of information, a lot of slides, and I have to say that's the long and short of it. I'm standing in a hole. That's the problem. But I've had a very great run with the Steelers, and there's just no better organization in the country in terms of sports with the Rooney family, and I've been very blessed, very fortunate to be able to share these experiences with an interested, concerned audience such as you. And I want to thank you very much. And I'd be happy to stick around and answer a few questions afterwards. Thank you.